It's an interesting question. It has been said for a long time there is an increased prevalence of epilepsy in autism. Some older textbooks say it is as high as 30%. But I have been repeatedly talking about it recently. The prevalence of seizure disorders in the normal, regular, everyday population is 1%. I actually now have had the good fortune of being in the same location, seeing large numbers of children with autism. I think the prevalence of epilepsy in autism is not 20%, not 30%, is more like 3%. So it's only a little bit higher. The other important thing is the kind of epilepsy that occurs in autism is not bad epilepsy. Staring spells with an abnormal EEG, a couple of seizures here and there, but it's not like epilepsy in general. The other important thing is some of the early information indicated EEG abnormalities. There are many EEG abnormalities in developmental disorder that do not necessarily cause epilepsy. Epilepsy is recurrent seizures. So unfortunately, there has not been a good enough large population study that looks at the prevalence of autism in an unselected population. Most of the textbook populations are a selected population, children with autism or behavior disorder that came to a neurology office or a neurology clinic where you are more likely to get an EEG. So, I personally do not believe the prevalence of epilepsy in autism is as high as what the old papers say, the textbook says. Epilepsy in autism resolves as you get older. It goes away. We don't have as many older individuals. Autism is ongoing epilepsy. Now, what's the exception? If you are more mentally retarded, if you have more motoric disability, and if you are microcephalic, small head, you are more likely to have epilepsy, and that epilepsy may be intractable. I personally believe the typical case of autistic regression, where a child looked normal for 15 or 21 months and regressed, is less likely to have autism. Less likely to have epilepsy. So I think this whole business of epilepsy should be better characterized if you had a large enough population study, which are not easy to get.